Okay, so now we are learning about engagement process. Okay, so in previous lecture I explained that what is engagement. Okay, in that what happened, the biparietal diameter which fix attached with complete pelvic brim means inlet part. Okay, inlet part and complete 0/5. Okay, here is a S shape that I explained you before. Okay, 0/5. Okay, fetal station head is completely cover this ischial spine. Now this fetal head, this transverse diameter, okay, biparietal diameter, okay, that is approximately 9.5 centimeter, which is a widest part, just like suboccipitobregmatic diameter. Okay, if you have learned fetal skull, then you should know this fetal skull diameter. Okay, if you want to learn about fetal skull diameter, you can tell me. Okay, let's moving forward to our topic. So in what happened in an engagement, now see, there is an abbreviation LOA, which means left occiput anterior. Okay, as I told you before, in normal labor, cephalic presentation and presenting part is vertex. Okay, cephalo means head, vertex means toppest part. Okay, pinnacle part of parietal bone. Okay, this one to parietal bone, this is called a, and this one is a what, sagittal suture. This one topmost part, which is called as what, vertex. Okay, so what happened, a vertex, firstly these two parietal bones are at what, which side, lateral side. Okay, this occiput part comes first in anterior side. Okay, but which side, so left side in inlet area. Okay, now head is started, fetal head is started to attach in inlet part nearer to ischial spine, maybe nearer to -5 to -4 degree. This occiput part comes in a, see, left side, what, left side, and now it's anterior portion. Okay, then it further rotate. Okay, this is called as a left occipitolateral position. See, okay, now when it comes by lateral side, first it comes anterior side, as you can see, now it goes lateral side. Why? Because as I told you, like it comes in a rotate movement, round portion, and then posterior parietal presentation happen. What happened? First occiput part comes in a anterior side, then it moving forward on lateral side, and then it goes by posterior side, and then this two parietal bone comes in a anterior side, and then complete this side 0 degree fetal station can happen, and then baby completely attached when pelvic brim. Okay, that is called complete engagement. As you can see, this one is a pelvic brim, inlet part, head is engaged 1 to 2 centimeter above spine. This is a starting phase, as I told you before. Okay, stages of engagement, and then after it comes in a partially, and then it covers whole ischial spine is 0/5 degree, which is called as a complete engagement. Okay, this one is a part of fetal head. Okay, it rotate motion, rotated head at vaginal orifices 5 centimeter below the spine. Now what experience, as I explained you before, belly drop experience. So what happened, in left occiput anterior of the vertex, fetal head enters pelvic brim with occiput denominator means margin area. Okay, it is arbitrary bony point which shows the relationship between maternal pelvis area with its attached part. Okay, so what is denominator? First is a occiput. Now that lying in relation to left iliopectineal eminence, that margin area, okay, between ilium and pectineal line. Okay, these are a margin cardinal areas of pelvic inlet. If you have learned maternal pelvis, then you know this iliopectineal eminence. Okay, now sinciput, the first area at right sacroiliac joint. Okay, now it moving forward what, in a lateral side with what, sagittal suture. Now two parietal bones come. okay, and lying in right oblique diameter. First it goes in a oblique side, okay, as you can see. First it goes in a oblique side, then it goes in a transverse side and cover the whole area, okay. See, the engaging transverse diameter of fetal head is biparietal, approximately 9.5 centimeter, and anterior, this one is a 2 parietal, okay, transverse diameter, and the another one is a anterior posterior. Anterior posterior means from topmost area, frontal part, to occiput part. Anterior posterior diameter, in that suboccipitobrachmatic. Suboccipitobrachmatic means the whole anterior posterior diameter from frontal bone to occipital bone, and in that suboccipito means from occipito to bregma. Okay, what is bregma? Anterior fontanelle. See, from frontal bone to occiput bone, that is the anterior posterior diameter, and this one is a bregma, from occiput to bregma. So there is a dividation, that is also 9.5 centimeters. So both the diameter remain on same place, which is called as a complete engagement. Okay, complete engagement. Okay, as you can see, anterior parietal, sagittal, first one is a left occipito anterior, then goes in a lateral side, then it lateral side moving forward. Now the sagittal suture, two parietal bones are come, okay, occipitofrontal plane, and then it goes posterior parietal sign, complete. It is called as a head in synclitism. What? It is called as a head in synclitism, posterior parietal presentation. Head in synclitism means complete engagement. Now two parietal bones come forward with what? Ischial spine, 0 degree fetal level. In abnormal labor, okay, in abnormal level, there is a asynclitism happen, okay, which is a different topic. But you should know what is synclitism and asynclitism, okay. This movement which occurs early in labor, not only head enters the brain, but synclitism occurs, okay. It is called as posterior lateral flexion, okay. Posterior lateral, flex means bending part, okay. The head occurs to glide. Glide means, okay, comes downward, from upward to downward, okay. The anterior parietal bone, the symphysis pubis area, okay, from when, which part? From inlet to symphysis pubis, which is called as belly drop experience. Posterior parietal presentation, okay. Okay, now on contrast, what happen in right occiput anterior? Now head moving opposite side, okay. So what happen? The vertex occurs where left oblique diameter, which somehow difficult for female to come out head, okay. Why? Because it's stuck at left oblique diameter of pelvis, okay. Transverse diameter can easily glide, transverse diameter of maternal pelvis, okay, can easily glide the fetal head, okay. What happened next? So descent. After that, descent, a continuous process when no bony tissue obstruction. Now fetal head totally outside, okay. At what area? On symphysis of pubis, okay. Symphysis of pubis is an area where maternal pelvis part called pubis, two pubis are attached at angle, okay. So that part, there is no bony tissue obstruction, because that is what? Cartilage, okay, cartilage present at symphysis of pubis, okay. Now it shows first stage and pronounced in second stage. It is a complete with expulsion of fetus, okay. It happened after expulsion of fetus, okay. What happened? At that time, uterine contraction. In such 10 minutes, 3 uterine contraction happen and retract, contract and retract, okay. Then belly drop experience, bearing down efforts, okay. Baby push, uterus push the fetus, okay. Uterus push a fetus to come out, okay. And what happened? A fetal ovary, specifically after rupture of membrane, the whole birth canal now stretch out, okay. So what is descent? So descent is a continuous process after after what? Complete engagement. In that, no bony tissue obstruction, okay. Now second stage is completely start. As I explained you before, this happen mostly in a second stage of labor, but in a primipara, primigravida, a female who give first time delivery. In that, from following successfully and of first stage of labor, engagement is start. And in this one, there is a mark when first stage is complete and now second stage is start, means half of the expulsion of fetus process is start. Okay, as you can see, you can take a screenshot if you want. Okay, it will be helpful. It is a decent process. Okay, now in next we will learn about flexion and internal rotation. Okay, till then, happy learning.